Excellent. Okay. Hello. All right. And if you can't find the chat area, don't worry about spending too much time on that because I want you to spend more time on learning than trying to find that chat area. And so as long as I know you can see and hear, I think that's great. That's the whole point, right? So the 5+5 rights to medication administration. We're going to start and dive right in. We're going to go into the safety portion of nursing pharmacology, and I'm doing something a little bit differently today. My lecture is not set up via a PowerPoint, but it's set up via a Quizlet. So you can go into Quizlet and you can utilize all the different things in Quizlet. Pull up Quizlet on your phone and go through the flashcards and utilize it that way. Okay, so looking at this, the 5+5 rights to medication administration are very important. When we have you do the medication administration, we have you do 3 times the 7 rights, which are the right patient, right drug, right dose, right time, right route, right assessment, right documentation. These other ones down here, you do them, you definitely do them, but you don't do them when you're pulling the med out of the cart. You do allow that patient the right to refuse if they decide they don't want a medication, as long as they're educated about the medication and they're able to make their own decisions. So they really do need to be making their own decisions in order for them to refuse. They really do need to be making their own decisions. Right to education, everybody, even an intubated patient, needs to be able to know why they're getting a medication. So even our intubated patients, we need to talk to them as if they can see and hear us, because oftentimes they can, surprisingly. And then the right evaluation. If I give a medication and it's for blood pressure, I better go back in and recheck that blood pressure at some time. I better be back in there making sure that that patient's level of consciousness is where it's supposed to be. Because if the blood pressure gets too low, then cardiac output gets too low, and so you'd see that in level of consciousness. Right patient, we're very specific when we talk about right patient. There needs to be 2 identifiers, and the room is not an okay identifier. And so the acceptable identifiers are name and date of birth, or name and medical record number, okay? Oftentimes, nursing homes will have kind of a different way of going about that because they've got a special population. So it all depends on the situation that you're in, but the right patient identifiers are name and date of birth or name and medical record number. The right drug, not only is this prescribed for this patient, but when I look at it, I should see, okay, they're getting this drug. Why are they getting this drug? What are they getting this for? So I look down and I see that they're getting Cardizem. Well, why are they getting Cardizem? Well, maybe they're getting it because they take that for AFib, or you know, maybe they take insulin because they've got diabetes. But making sure that you check that is of utmost importance. The doctors are human, and sometimes they'll make mistakes, and sometimes they'll write things on the wrong patient. And so it's really important to go, whoa, wait a second, what is that patient getting that for? You know, I've had a doctor write an order on the wrong patient for a vasoactive drip that would have brought the blood pressure up, but that person was already hypertensive and it would not have benefited from that. And the doctor said, oh, thank you for seeing that. I am so sorry. Oh, Alicia. Okay, so the right dose is not just that it's ordered that way, but also I have looked up in my med book that that's an appropriate dose for somebody that age, that weight, sometimes and is it the right dose for that person? So, and have I done the math correctly? When I'm at right dose, I want you to think really hard. When you are on your job, you have to be there and show up at 100%. That's why nurses drink coffee. So that's why we drink coffee. But what I mean by you got to be there and show up at 100% is that right dose, and this is why we have students not come to clinical after a full night of work, because that right dose is really important. And you have to be thinking it on your toes. And if you've done the math and you've checked it with a second person, there are some red flags that should really be going off in your brain if you see that I need to give a whole bottle of something. That's what happened in one of those morphine stories that you read about, is that they ended up giving a whole bottle, which is just unheard of. And so something should have clicked in their brain that said, oh, this looks dangerous. And so the other thing is, you know, if you need to give more than a couple of tablets of something, double check that dose, call the pharmacist, have another nurse double check your math. Ask the physician, should we really be giving 10 pills of whatever it is they've ordered? Because that's not normal. That should send off red flags, right? The right time, not only is it the time that it's ordered for, so in the computer you might have a patient that comes, say, into an emergency room and they get their first dose of Zosyn, okay, and it's set to go every 6 hours that they get this. And in the emergency room, oftentimes they'll do a one-time dose and then it'll kind of fall off the MAR, or the medication administration record. So it'll fall off of that MAR, and then they'll come to the floor, and when they get to the floor, that med will go into the computer when the hospitalist puts it in as to be given right away when they come up to the floor. But you know that they just got it down in ER. So you need to retime that med so that it's every 6 hours rather than because of some computer glitch ending up just right after they got it. So that's something you really want to be watching. Right route, definitely make sure if it says IV, PO, if they don't indicate the route, you must clarify that. Does anybody know, here, I'm going to look and see how you call in. Okay, so meeting info, I bet. Okay, so what I'm going to do is, this is for Okay, so this is for Alicia. I am going to, Alicia, let's see, I'm going to move this up, see if I can move this over here just for now. There we go. I want everybody to be able to hear. So, okay, close that up. So the right route, the right assessment. So if you're giving a medication at a clinical or as a nurse, if you don't do the correct assessments before giving that medication, you won't be safe to be giving that medication. So the right assessment is if you've got a blood pressure medication, that you've taken that blood pressure. And some of them, it's required that you get their heart rate too. And so that you've done that focused assessment before you get in with that patient, but also before you even take the drug out. You want to have that right assessment in. If you're giving insulin, what are you going to do before you give the insulin? Well, you're going to check a sugar. So let's make sure we do that before we get to the cart, to even, or the med room, or the Pyxis, or wherever it is where we get our medications. Make sure you've already done that assessment and been prepared. Right documentation, always document, 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 as it's the only way to prove that you've done something. So there we go. Then they also talk about the 6 rights of medication administration that a nurse has. So a nurse has rights of medication administration. And this is the thing that I like because I can probably think back to several times where these rights have been compromised. But I need to, as a nurse, advocate for myself to make sure that these rights are upheld because it makes patients safer. The right to a complete and clear order. So have I seen unclear orders? Absolutely. So does anybody know, you can type in the chat area, if you've got access, go ahead and type in the chat area, who do I call to clarify an order that's not correct or that is unclear? Excellent, Fatima. Right, the prescribing doc, the provider. The NCLEX will call that the provider, but the prescribing doc or the nurse practitioner or the PA, whoever wrote that order, needs to clarify that for me. And the NCLEX will call it the provider. Just because we have so many variants of providers nowadays. The right to have the correct drug and that route and that dose. So I run into shifts where I don't have the correct drug route or dose, and in order to remedy that, I need to call the pharmacy, right? So it doesn't mean that all of these things are going to be present, but I need to remedy them at some point to make sure that I'm actually giving, excuse me, got a frog in my throat, the medications safely. So the right to have access to information. So actually, when Joint Commission comes around, they do things like this. They look for, okay, do you have a med book? If you don't have a med book, is that information in your electronic medical record accessed through Micromedics? Do you have the things you need to deliver medication safely? The right to have policies to to guide safe medication administration. So think tanks of people, which I encourage you to be a part of. So in meetings where people are deciding on policies, we have the right to have safe policies to guide medications and their administration. The right to administer medications safely and to identify problems in the system. So the incident report is designed to identify problems within the system. And the incident report should be focused on making the system better, not getting people in trouble necessarily, but making things better. The right to administer, sorry, I almost read that one again. The right to stop, think, and be vigilant when administering medication. So that the process isn't super rushed. We should have a process whereby we actually have time to administer the medications appropriately. So just a second here. So is that something that we always are going to walk into on every shift? Possibly not, but we need to remedy it before we go ahead and give the medication so that we have a safe environment and a safe administration of meds. Just culture. Okay, so employers should not use punitive measures on a regular basis for things that go wrong that are put into incident reports or near misses that go into incident reports. So we should focus on fixing the system, reporting encouraged to reduce negative results for patients, but gross misconduct is still not tolerated. And Alicia, were you able to get your phone working properly?
Yes.
I know when I first used WebEx, I had to have IT put it back in to make sure, because then I'll close down this meeting information if you need.
Yes, I do.
Okay. 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 So I'm just going to scoot down here. National patient safety goals are something that you're going to also explore in another class, but they're things put out by the Joint Commission to make patients safer. And so they're different in different settings. So if you work in a nursing home, it's different than if you work in a hospital. And the black box warning is the sternest warning by the U.S. Food and Drug Administration that a medication can carry and still remain on the market in the United States. So black box warnings are very, very awful side effects. So some of the most terrible side effects, and they actually happen at a more frequent rate than some of the other ones. It appears on the label of a prescription medication to alert you and your health provider about any important safety concerns, such as serious adverse effects or life-threatening risks. Drug reconciliation is drug reconciliation. Does anybody work where you see nurses doing drug reconciliation? So whenever a patient or client, because the NCLEX nowadays, the buzzword is client. So patient and client then become interchangeable. So drug reconciliation is defined as the process of identifying the most accurate list of all medications that a patient is taking at transitions in care, which includes admissions and discharges from a hospital or to another healthcare setting such as long-term care. So medication reconciliation means we're making sure we have the accurate list of meds, but it happens every time they transition from one place to another. So if they go from the medical surgical floor over to a long care center's TCU, then they would have that done. If they come into an ER from the community, we do a medication reconciliation. So it's very important. Disposal of medications, really and truly, there is a list in our book of medications that specifically state that they should be put down the toilet. And most facilities will have really great policies as to how they need to get rid of their medications. So medications we get rid of based on both the Food and Drug Administration, the DEA, and the EPA. So if you're working in a facility like a hospital or a nursing home, they've got very specific policies, and it's based on how big that facility is. It's based on how populated the area is, and things like that. If somebody is at home, say you're in a home care setting or you're at a clinic, so many meds, unless they are on that list where it says to flush them down the toilet, unless they are on that list, we do this. We remove the medications from the original packaging and mix them into something that's unpalatable, such as dirt, kitty litter, or used coffee grounds, so that people don't want to reuse it. And then we place it into a sealed bag. We throw the container into the household trash and scratch out any personal information, because that would be a HIPAA violation to put it in there without scratching out that personal information. So, but there are some meds, and they're in your book. You don't have to memorize which meds get flushed down the toilet. That's something you look up. And if you're not sure about it, you know, there's usually a pharmacy that you can consult if you're working at a clinic or you're working at a or if you're working in a home care situation, or it might be indicated somewhere in their policy too. When we're talking about safety, I always want to let people know. So I'm going to go, and it's hard with this sharing screen button, but I'm going to pull you to a place called the ISMP. And the ISMP, you don't have to go to it right now, but this is an Institute for Safe Medicine Practices, and I do go on here quite a bit to follow up on things that are going on in the world, and mistakes that are happening and trends in these mistakes that are happening. And so that website is where I ran across a few things about the fentanyl patches. Now, fentanyl patches, kids will find them in the garbage cans, and there are instances where infants have eaten fentanyl patches right out of a garbage can. And so it's really important to know what your facility's policy is on that, and teach people that an open garbage can is not the proper place to put this, especially if they have kids or grandkids or animals. Or so I'm going to move on now. Another key point of safety in the safety chapter is the fact that we look at look-alike sound-alike drugs, so things like ceftriaxone and ceftazidime. these will use tall man lettering so that it'll pick out different letters so that it'll list our eyes to the fact that these are different, but they will look very similar. And so I suggest if you're a speed reader, you read forward and backward, okay? So then the other safety thing, and this is something I really want to reiterate for people. It kind of belongs in ethics and safety. Who can give a medication if you've prepared it? Well, only you. Absolutely. So if you have prepared a medication, you are going to be the one that's doing it. So if a nurse draws up insulin, I've seen this before at clinical sites. If a nurse draws up insulin, they can't just hand it to the student and allow the student to go give it. That's not okay. If you draw up fentanyl, or even if you have pulled it out of the Pyxis, you should be the one administering it. So you can go ahead. I will be giving you a link to this site after this, but I want to show you, you all know about the flashcards, right? So you can do these as flashcards. You can do them as a test. So this will auto-generate a test for you if you'd like. They'll have some fill in the blanks, some matching, some multiple choice that it'll make out of these. So there are all sorts of, and then gravity is something new. Yeah, no, I'm not gonna, you can definitely play that one, but I'm not gonna pull you there right now. Matching, this is gonna time you to see how quickly you can do this. So who can give a medication if you've prepared it? I'm gonna match it. Good, it goes off of the screen, and then the goal is to clear the screen as quickly as possible. So you can do all these things with these flashcards. You can even, I think you can have them read to you somewhere in here. Yes, you can have them read to you if you click on this part here. So it's kind of a nice feature. I thought it would be a great way with all these terms, a great way to do this lecture instead of let's see, my study sets. There we go. Okay. So herbal, complementary, and alternative therapy. I kind of narrowed down the herbals because there are so many of them. I think for anybody to memorize all of those herbal medications, I think is absolutely insane, right? So I've kind of narrowed them down, okay? But there are some that are really common that you should know about, know what they're used for, and what their nasty side effects can be. Chamomile can be used for sleeplessness, anxiety, the stomach, intestinal ailments, some skin conditions, oral ulcers that are secondary to chemo or radiation. Now, none of these herbals are actually quote unquote proven to do any of these things, but they are used for this. Side effects of chamomile can include anaphylaxis and other allergic responses. Garlic, inconclusive evidence supports the use of this herb to be used as a treatment for elevated cholesterol, hypertension, heart disease, colorectal cancer. Side effects include heartburn, upset stomach, body odor. I mean, these are things that you know. I mean, if you have too much garlic in a meal, how many people have reflux and an upset stomach? There is a slight blood thinning to it. And then it's contraindicated with a drug that they use in for the treatment of HIV called saquinavir. So don't worry, I even have problems pronouncing some of these words. Cinnamon has a long history of treatment for bronchitis, GI problems, anorexia, and diabetes. I'm supposed to say there's little evidence to support these claims. And so this one also decreases blood clotting, so it can result in a little bit of a thinning effect. Echinacea is commonly used for colds, flu, and infections. So it's been used for skin problems such as acne. It's thought to kind of stimulate the immune system. Few side effects are really reported, most common just being GI and allergic reactions. More common in people that have ragweed issues. Ginkgo biloba can be used for asthma, bronchitis, fatigue, and tinnitus. It is thought to improve memory. Again, none of these herbals, we can't really prove that any of these herbals work, but they are used for that. Many of them have been used for that for a long time. Very important to know, ginkgo has been shown to increase the bleeding risk. So, and in fact, ginkgo biloba, if somebody was taking that with, say, warfarin or Coumadin, which is a blood thinner, we would need to let the doctor know about that because it could change their bleeding tendencies. And then ginseng is used for the immune system, and it increases a person's sense of well-being and increased stamina. It's been used to treat erectile dysfunction, hepatitis C, menopausal symptoms, and to lower glucose and blood pressure. Long-term, it's associated with side effects like headaches and GI problems and allergic reactions. Peppermint, this is probably one of the most useful of all of the herbs that we talk about because it really, I cannot say enough about peppermint. Peppermint allows things to open up a little bit better. So nausea and indigestion, it helps to open up those areas where we might have sphincters and allow gastric emptying. Irritable bowel syndrome, it seems to calm that. Cold symptoms, it can open up your nasal passages. Muscle and nerve pain has also been associated with being able to help. That's why all of your products that you put on that are topical that smell like mint, that's because the mint products can do that. And then St. John's wort. St. John's wort is used for depression. It's not recommended as it doesn't work as well as some other meds that are out there. But people have been using it for many, many years. The thing is if people take it with other antidepressants, it can lead to serotonin syndrome. And so it interferes with almost all the meds that are out there. So just remember that. St. John's wort is really an interfering type medication, and it interferes with all sorts of things. Turmeric has been used for heartburn, stomach ulcers, gallstones, inflammation, and cancer. There's also some anecdotal support for that it's good for your skin. And it can cause nausea and diarrhea, but that's only at really, really high doses. Decoction is really talking about how these things are made and supplied. So decoction is There's a tea made from a boiling plant material, usually the bark, the rhizomes, or other woody parts, maybe used therapeutically. Natural dyes are often made this way. So if somebody has an allergy to something and there's a natural dye in something, if this is, any of these things have been decocted and they end up in that dye, then maybe that person will be allergic to that. So an infusion, a tea is made by pouring water over the plant material. The mixture is allowed to steep, and the water is usually boiling, but cold infusions are also an option. They may be used therapeutically. Hot tea is an excellent way to administer herbs. An extract of a plant made by soaking herbs in a dark place with a desired amount of either glycerin, alcohol, or vinegar for 2 to 6 weeks. So you can think that this one is probably going to be a little bit more potent. The liquid is strained from the plant material and then maybe used therapeutically. Essential oils. This is how we see a lot of these meds, right? In our culture, they're sold as essential oils. So aromatic volatile oils extracted from leaves, stems, flowers, and other parts of the plant. Therapeutically used, we usually have dilution of a very highly concentrated oil. So, you know, I will go ahead and say I'm supposed to tell you that there's no evidence to support these, but we use peppermint at my house. We use tea tree oil, and so they're very commonplace, right, throughout the world and throughout people's homes. So I just want you to, this isn't one that I want you to sit down and memorize word for word. Just know that it exists. There's a Dietary Supplemental Health and Education Act of 1994, where dietary supplements were defined, and they were defined, they're intended to supplement the diet. They contain one or more dietary ingredients like vitamins, herbs, those kinds of things, intended to be taken by mouth, labeled as being a dietary supplement. The labels are required to have the name of the supplement, the amount of the supplement, some nutrition labeling. People need to know what's in there as far as allergies are concerned. So we've got an ingredient list. The name and place of the manufacturer. So some health claims, some structure and function claims, and the nutrient content claims. So current good manufacturing practices, there's standards that are multifaceted and require that package labels give the quality and the strength of all the content, and that the products be free of contaminants and impurities. So manufacturing quality control procedures are part of CGMPs. So it's like a seal of approval that's awarded if they meet that criteria, and then there's a fee involved with it. Okay. Few more things you need to know. Botanicals are additive substances that come from plants. And an herb is any plant that is used for culinary or medical purposes. So you might use garlic or cinnamon for a culinary purpose, or you might use it, or turmeric, you might use it for medicinal purposes. Really do know the difference between complementary and alternative therapy. Star, 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 right? Complementary therapy is in complement to conventional medical treatment. So if I am taking an antibiotic, and if I'm taking antibiotic once in the morning, once at night, and at lunch I go ahead and I have my tea with echinacea in it, that would be complementary. On the other hand, alternative therapy is in place of conventional medicine. And so we run into all sorts of ethical dilemmas with that, right? Because if you're using something in place of conventional medicine, is that ethical? Well, people have the right to choose, and then we run into the case of kids. So that becomes an ethical dilemma. So everyone knows the story of people who have decided, nope, I don't want the chemo. I want to go get acupuncture instead. That would be alternative therapy. If they decided, you know what, I'm going to get the chemo and I'm going to try acupuncture, then the acupuncture would be complementary. It's all in, if it's mixed with modern medicine, then it's complementary. If it's a standalone in place of modern medicine, then it's alternative. So does that make sense? It's easier to tell in person if people are enjoying the show or not, but you know, that's okay. Hey, at least you didn't have to ride in traffic. Traffic out here did not look good there for a while. So I've got one more section of stuff to go through. And then I've got a Kahoot quiz, and I'll open it up for some questions. And then I've got kind of a really, really fascinating video that I ran across that I'd like to share with you. So let's see. Every once in a while, I hide the things I need to get to, and then I'm thinking, okay, where do I need to go? So we went to safety, now to ethical development. Okay, when I'm talking about ethical and development, I mean ethical and development of drugs, okay? So there are a lot of ethical implications in the development of drugs, so we definitely make sure that we follow those. Autonomy is something that each individual needs to feel, right? It's a feeling of independence and self-determination. Beneficence is something that all of us nurses want to do. We just want to do good, right? We want to be beneficial to people. One thing that we talk about is a brand name. So a brand name is a commercial name for a drug. So a trademark or a trade name like Tylenol, and fortunately misspelled that. I'm so human. So a chemical name is the name that describes the chemical composition and molecular structure of a drug like N-acetyl para aminophenol, which is Tylenol. It's Tylenol, so yeah. Then we talked about controlled substances, a drug that has the potential for abuse and thus is regulated by the law. A critical path initiative. Approval of new drugs. This again, don't memorize it word for word, just know in general what it is. Approval of new drugs by the U.S. Food and Drug Administration has been studied since the early 2000s, which kind of ballooned in 2014 with 44 new drugs being added. To facilitate this increase, but still make sure that there's still good process involved, the FDA established a critical path initiative to drive innovation of scientific process so that we can improve the prevention, diagnosis, and treatment of rare and neglected disorders. So, you know, if a drug is going to work for something, they want to get it out there if it's going to help people. When they do, I'm going to actually, I wonder if I can move this. No, I can't. I want to pop down here to where it says generic name because we mentioned the commercial drug name, we mentioned the trade name, which is the commercial name. We also mentioned the actual chemical name. The generic name is a legal, non-commercial name for a drug. So that would be something like acetaminophen. I'm going to slide down here to Good Clinical Practice Consolidated Guidelines. So again, don't memorize this word for word, just to understand what this one is about. The FDA requires clinical research to follow the Good Clinical Practice Consolidated Guideline, which is an international ethical and scientific quality standard for designing, conducting, monitoring, auditing, recording, analyzing, basically making the research for the drug. So additional guidance is available from the FDA. So they govern those good clinical practice guidelines. So whenever we do an experiment, is there anybody out there that hasn't had psychology or hasn't had biology or anything like that? Don't feel obligated to respond. It's okay. When you're doing an experiment, you formulate a hypothesis, right? And you conduct this experiment. In the experiment, I'm going to skip down here. During the experiment, you you manipulate an independent variable, okay? So it's something that the independent variable in a drug study is often the drug itself. So maybe one group, the experimental group would get a drug, and the control group would not get that drug. And so that's the experimental factor that's manipulated is often whether you use the drug or not. The drug is the independent variable. And then the result that happens in that research based on who got that independent variable drug and who didn't get that independent variable drug, the result that happens, the measurable effect, the outcome or response, that's the dependent variable, okay? In research, we don't want to just go ahead and start testing on people. And I'm going to show you something here in just a little bit. And you'll go, oh, that's why we do that. There are if I can speak, preclinical trials. Prior to the implementation of clinical research, the FDA requires preclinical trials, okay, because we need to know how toxic is that, how much could we possibly use and what's effective, but oftentimes it's done either, it says in vitro, which is like in a petri dish or a test tube, or in vivo is in something live, but that's animals, okay? So those are preclinical trials. And then what I want you to know about human clinical experimentation is that it goes through a bunch of phases to ensure the safety, okay? And we get, from these human clinical experimentations, this is where we get those side effects that are listed about drugs. So they're very important. It's just that we need to go about it in this manner that the FDA, the National Institute of Health, Best Pharmaceuticals for Children Act, Pediatric Research Equity Act, these places all have kind of guidelines that we can follow to keep it safer. And that's really what I want you to learn about human clinical experimentation. You're never going to memorize all those words. We talked about the independent variable. Informed consent. When we talk about informed consent in nursing, this is something that a nurse witnesses the signing of, okay? but it's the responsibility of the researcher or the provider to complete the informed consent and do the following: an explanation of the purpose of the research, description of the procedures to be followed, identification of experimental procedures. Make sure you read through these. I want you to know about them. But I want you to memorize that a nurse witnesses this. It's the responsibility, though, of the researcher provider to complete the informed consent. We witness the signing of it. Know the difference between justice and veracity. A lot of people have a tough time with that. Justice is fairness. You can think of justice as sitting in a court. Somebody can be a justice, right? There's a justice of peace. There's a judge that's operating through justice. They're making decisions that are out of fairness, right? Veracity. Veracity is truthfulness. I wish that everybody I met had solid veracity. And I wish everyone was truthful and honest, right? That's what nurses want to be. We want to offer justice to our patients, and we want utmost veracity also. You want to know the difference between over-the-counter medications and prescription medications, which that one's simple, right? So if it's over-the-counter, you can buy it over-the-counter without a prescription. If it's prescription, you need a doctor's order, right? Then you also need to know what a placebo is. So something which has a positive mental effect but no physical effect. So it's often referred to as a sugar pill. So the placebo, the best example, right, of even a non-medicinal placebo is if a kid falls and hurts their knee and mom kisses it, makes it better, and it gets all better. Respect for persons, treating people as autonomous agents and protecting those with diminished autonomy. You guys are going to run into clients, and NCLEX likes to call patients clients. You're going to run into clients in nursing too who have real diminished autonomy. And you are going to be, you are really so much of their dignity for that day, and you're providing so much dignity. The risk-benefit ratio, all these drugs that we talked about, they're going to have side effects, and so we want to make sure that the benefit is worth that risk. And then maleficence is the quality or nature of being harmful or evil. Okay, so this is the part where I get to be fun, okay? Because let me tell you, listening to all those, sometimes, you know, it can be not so fun. So I am going to close this. There we go. Yes, I did. I'm closing that. Save. Okay. So does anybody have Kahoot on their phone? No? Okay. So I'm going to let you go on in. If you want to participate, you can. If you just want to watch, you can. But it's really fun to participate. I'll show you what Kahoot looks like. Here it is. Okay, let's see if I can show you on my phone which app Kahoot is. You know my apps.
Did you download it?
Yeah. Yeah. It's just tough to actually show you. And there we go. Kahoot. Yeah. So you go into your Play Store and you can download Kahoot. And here, I'll write it right here. Oh, somebody's got a sweet little one. So I'll give you, if you'd like to download it, go ahead and download it. If you don't want to, that's okay. I'm going to give you a little bit of time, about 10 minutes. About 10 minutes for a break to get up, walk around. I think we've done enough listening for a little bit. So at 5 minutes after 10, so I think that that'll give people time to download Kahoot on their phones if they'd like. Plus, it'll give people time to go to the restroom if you need. Okay? I'll be back here shortly. Okay, I'm going to give this another couple of minutes here. I love the names that are coming up here. Okay, and we're almost time up for signing in. So if you're going to go ahead and sign in, please do so soon, and then we'll start the quiz. But you can definitely be listening in, and if you don't have your phone with you or whatever it is, then you can still participate by watching indefinitely. So we'll go ahead and start. Okay, are you ready? The nurse knows immediate intervention is necessary when Okay, so the nurse knows immediate intervention is necessary when, so the answer is when a nurse asks you to administer the insulin he or she drew up. So this one is important to remember, this type of a question, because here we're looking for basically a wrong answer. If we need to do immediate intervention, that means something is wrong with this picture and we need to intervene. If a nurse answers a call light after locking the med cart, that's definitely an okay thing. That's definitely a good thing. Thank you, Fatima. So that's definitely a good thing. To lock the med cart before you leave it. So you can see where you are on here. This is why I don't have people put their real names in, but you can kind of see where you are, where you're going here. Let's throw this down here. That's a good password for now until we hit the next. The nurse knows that the following is not an example of the medication right. All right, so most people answered the right room. You are correct. That is not an example of the medication right. Patient
drug time, those are all medication rights of administration, but right room is not. Excellent. So, wow, Lulu, you're doing fantastically. You all are doing well. Okay, a patient on warfarin, a blood thinner, recently purchased ginkgo biloba. The nurse Okay, the nurse informs the provider. So this is a good one to look at because it's a great question of are we functioning within the role and scope of the nurse? So our scope of practice would be we inform the provider so that they can prescribe. This one, it says tell the patient to stop the ginkgo, tell the patient to stop the warfarin. Those two things are within a physician's or a provider's scope of practice. Discards the ginkgo properly in the toilet. That's just kind of a nonsense answer. I'm glad nobody answered that one. So the nurse is very concerned that each patient is treated fairly regardless of insurance type. Okay, right. This is an example of justice. What is just? So this we can translate this also into how nurses treat people. So we treat people just as well if they're the Queen of England as if, just like we would treat someone if they were a prostitute. And so we treat everyone fairly and just, and that is why that's why we're well respected as nurses. And one of the reasons why I'm very proud to be in this profession, that we treat all people fairly and well. So great job, guys. The nurse knows that genotoxicity is determined during preclinical trials. Absolutely. So genotoxicity is done during preclinical trials, both in vivo and in vitro. So vivo is living creatures, and animals are in that category. And in vitro is the test tube or in the petri dish. And they're going to determine if at the DNA level, if we're wrecking DNA, which is a very important thing. But that would be genotoxicity if it did indeed wreck the DNA. Do some drugs get through that are maybe genotoxic? Again, that's a risk-benefit analysis, but not usually. They don't usually get through. As a nurse preceptor, you know the following would violate a nurse's rights of medication administration. Exactly. The nurse is to attend a meeting during medication administration. That would not be congruent with the nurse's rights of medication administration. The chemotherapy patient is nauseated. Which of the following will help with the nausea? You are correct. Peppermint. It'll open up that the sphincter and allow for gastric emptying a little bit better. The nurse knows that the following medication can be crushed. You're right. The extra strength Tylenol can be crushed. Enteric-coated aspirin has a coating on it that is meant to stay on it as it passes down into the stomach. And so if that was crushed, then it would defeat the point of it being enteric-coated. And then OxyContin has the contin, so that C-O-N, and I'll write it down right here in the chat area too, C-O-N-T-I-N, kind of looks even like continuous. So if you see that at the end of a word, it means that it's kind of a continuous release. And then, so you'll know that that's a medication we shouldn't crush, because then all of a sudden they're going to get what they should have gotten over a period of so many hours. They'll get that boom all at once. Nucynta, you didn't need to know the name of the drug. It's a newer drug. The fact that it says ER, or extended release, ER stands for extended release. The nurse knows that a very stern label on a medication is a black box warning. And to just remember that is just going over that a little bit in the Quizlet. The nurse knows that the goal of a risk-benefit ratio is it is the green one, the square, that the benefits outweigh the risks. You want more benefits than negatives. You want more positives than negatives. The nurse knows that an example of complementary therapy would be, I'll move this out of the way, sorry. Right. The use of peppermint and Zofran for nausea would be example of complementary therapy. A back massage and St. John's wort, neither of those are mainstream medicine. They're both alternative, and so there's nothing in there of modern mainstream medicine, so they're both alternatives, so that would actually be alternative therapy. So same with the peppermint and the turmeric. The use of cinnamon for diabetes. If it was cinnamon and insulin, then that would be an example of complementary therapy. Again, if somebody was taking cinnamon and insulin, we would need to let the doctor or provider know about that. In an experiment, one group is given a medication and the other group is not. The nurse knows The medication itself is the independence variable, okay? So that's the independent variable. It is given to the experimental group and oftentimes withheld from the control group. And then what happens because of that independent variable is that the dependent variable happens. Oh, Lulu, you won! Yay! And I can go get results, and I can save my results, download my results,